Well, you're looking at it, Bourbon Street here in the heart of the French Quarter in, of course, New Orleans in Louisiana. And if you've been following the media at all, you know that Louisiana has been hit especially hard by COVID-19. As of now, there are about 37,000 cases in the state. More than 1,300 people have passed away. And this is what it is doing to the economy here. People are just afraid, they're concerned. And it has spread so rapidly that now everybody has retreated and they are following the mandate to self-shelter. So we are able to walk down the heart of Bourbon Street, right busiest time of the day, right in the late spring when it would be packed with people. The weather could not be better. But the concern, obviously, the economy is a huge concern. But what about the personal safety of these areas? Well, we went to a couple of hospitals and we were able to see people who had tested positive for COVID-19 who are being treated in those hospitals. And while this is how most people see the coverage of the coronavirus, empty streets, buildings that are all boarded up and shut down, but the hospital staff, and especially the patients we were able to chat with, said we need to remember that this is much more than statistics. There are people that are suffering from this, the number of people throughout the United States. It is going to be the question of how do we come out of this? And that is what New Orleans is struggling with right now. They've canceled 3 of their main events, Jazz Fest, Voodoo Fest, and the Essence Festival. The big question is, how can they continue to take care of people, work with the COVID-19 situation, and find a way to cope with an area that needs tourists to thrive, to exist? And that, sadly, is what all this is going to come down to.